In this video, we look at auditing tympanostomy. So our pre-op, post-op diagnoses are chronic otitis media with effusion and adenoiditis. Our procedures performed: bilateral tympanostomy with placement of ventilation tubes, number 1, number 2, and adenoidectomy. So our procedure: after this 10-year-old patient was placed under an anesthetic with a mask inhalant, the nasopharyngeal area was examined, and a moderate plus amount of adenoids were noted to be present. That should be pus, as you can see, not plus, right? Moderate pus amount of adenoids were noted to be present. The patient was then intubated, and following this, the right external auditory canal was cleared of wax and prepped with betadine, and a radical incision was made in the anterior inferior quadrant. The serous fluid was suctioned from behind the drum, and a 0.39 millimeter ventilation tube was placed. The left canal was then cleared of wax and prepped with betadine. A radial incision was made in the anterior inferior quadrant, and serous fluid was suctioned from behind this drum. A 0.39 millimeter ventilation tube was placed. The MacGyver mouth gag was inserted, and following this, adenotome was used to remove her adenoids along with a curette. The nasopharynx was then visualized, examined, and palpated to be sure that the adenoids had been removed. Once this was completed, a bismuth pack was placed. The pack was then removed, and electrocautery was used to obtain good hemostasis in the nasopharynx. The nasal cavities were then irrigated and cleaned well with normal saline along with the oral cavity. And once the nasopharynx was rechecked and adequate hemostasis was present, the patient was awakened from anesthetic and returned to the recovery room in stable condition. Prognosis: immediate remote is good. Estimated blood loss was 20 cc's. Our instructions state: one or more of the following codes are reported incorrectly for this case. Include the incorrect or correct codes indicate. So our CBT, it says adenoidectomy code 42830 and tympanostomy with tubes 69436, modifier 50 and modifier 51. And our diagnosis, it has hypertrophic adenoids, J35.2, chronic otitis media with infusion, H65.493. So take out your ICD-10-CM book. We're going to look at these codes. First, let's look at our J35.2. Okay, J35.2 says hypertrophy of adenoids, which hypertrophy, right, if we think back to medical terminology, that means enlargement. It did not say enlargement in our documentation. If we go back, it says adenoiditis. Remember, itis is inflammation of. So if we go to our book, we do not want hypertrophy. We want adenoiditis. So let's go and look that up. So open up the front of your CM book. We're going to go to the name of the condition, which is adenoiditis. Okay, so right here, adenoiditis. We can pick with tonsillitis or acute. We don't know, so we're just going to do the unspecified, which is the one right next to it, the J3502. So let's verify that code. Let's go to J3502. So J3502 is just chronic adenoiditis, which is what we want. So we know we want that instead of the J35.2 that our answer had. And now our second code, if we go back to our statement, was chronic otitis media with effusion. and they gave us H65493. So let's look that up. H65493. H65493 is other chronic non-suppurative otitis media bilaterally. So that is correct. That was verified in our scenario, right? If we go back to our scenario, chronic otitis media with infusion. So that is what we want. Now let's look at our CPT codes. See if these are correct or incorrect. Our first CPT code is 42830. So open up your CPT manual to 42830. Adenoidectomy, primary, younger than age 12. If we go back to our scenario, our patient is 10. We did an adenoidectomy, so that code is correct. 42830 is correct. And our second, tympanostomy with tubes, 69436. So let's look up 69436. Tympanostomy requiring insertion of a ventilating tube, general anesthesia. If we go back to our scenario, tympanostomy with placement of ventilation tubes, that is correct. The patient was placed under anesthetic with mask inhalant, so that is general, that is correct. So our code 69436 is correct. Now let's look at those modifiers to see if those are needed. Remember, they're at the front of your manual. So modifier 50 is bilateral and 51 is multiple. So our procedure, let's go back and see if it was done bilaterally. It says bilateral tympanostomy, and there is multiple because there's more than one procedure, so those codes are correct, or those modifiers. So our codes should be J3502, J35.2 was not correct, and then H65493 is correct, 42830 is correct, and 69436 with both modifiers is correct. So you can go to find a code if you want, again, to search those up. We can, go to index. If you weren't sure about that adenoiditis, we could come up here to our index for ICD-10. Just make sure you switch it to ICD-10 and then type adenitis. We don't want adenitis, we want adenoiditis. There we go, adenoiditis. And if we go over, just like we saw in our index, J3502, if you want to see the notes, they're right there. Again, you can just go up to codes and you can just enter your code, J3502. You have to put the period in. So it takes you right to the tabular. And we can see here that we would pick the J3502. Now, if you wanted to look at the other code that we had, the J35.2, again, you can just go right back and type J35.2, and that would bring us, again, right to the tabular hypertrophy of adenoids. So you can check all your codes by doing this. ICD-10, let's put in our otitis code H65.493. Brings up that code. Again, we can do this with our CPT codes. And our last CPT code, (69436). Remember, don't enter the modifiers. Remember, you can go up to your tools, to the coda note, if you want to enter the information in there. So we can just come over here and copy and paste this information, Control C, then I'm going to go back to my find a code, Control V, go down, hit the scan. It takes just a few seconds for the potential codes to come up. Again, the codes are going off everything that might be documented. As you can see, there are many codes which we would not even assign. Most of these are not even documented. The correct code for adenoiditis is there, which is nice. But if we look at our chronic otitis media, neither one of these is correct. We want the H65.493. So that one's close, but it's not a complete code. And then let's see what there's for CBT. You can see there are many to pick from. So it does have the correct one right here for that adenoidectomy. And then it also has the correct one for our bilateral tympanostomy with the ventilation tubes. So again, you, the coder, have to decipher what is coming out of the CAC, but this one, it had at least some of the correct codes.